mask. Please wear your N95 mask. Do not just think that the little paper masks is going to be acceptable. Okay? Wear your N95 mask. If you know a patient has TB, make sure they're wearing their mask too.
They don't.
Oh, I'm gonna tell you. Put that mask on. What you got a mask for? Well, put that on for me. But, you know, we're gonna be in a. Think about y'all haven't been to the ultrasound room. God, it's like a 8x8 room. It's like a big closet. You know, it's not a huge room at all. And you're in that little bitty room, all that bacteria flying around. You know, I need you to protect me too. So put that mask on.
Where is it though? They have it inside the.
Every room is gonna have N95, bedpan, urinals, emesis basin, all of that kind of stuff you need is gonna be in the rooms already. But you guys are responsible for stocking it up if they don't have it. Okay, so check your room because you don't want to be having to run out the room to try to get some medical supplies when they're supposed to be in there.
So, sorry, you can tell the patient why don't you wear your mask?
If I know that person has TB and they have, say if they have their mask and it's just on their chest, or some people might just put it around their neck. That mask on, yeah, I'm gonna tell you. Because they know they're supposed to have it on, yes.
What if they refuse?
What if they refuse? I mean, I've never had that situation occur to me. I mean,
We don't do this here.
I want to say that you're gonna end up having to do that exam at some point. It depends on, like, I'm gonna, you know, I don't know why would somebody refuse. You know, yeah, if they refuse, I'm gonna get with the nurse. Me personally. You know, I must make sure I have. Whenever I wear my N95, guys, I always wear 2 masks. It's hard to breathe. It's hard to breathe with N95, but N95 leaves such a big indentation on your face right here. You could be walking around for 4 or 5 hours, depending on how long you had it, with this big mark. So I always wear the other mask underneath it, so I don't leave the indentation on my face, and then I wear the N95
like the
mask on top of it because you know I just don't want them lines on me. You know?
Now you wear the paper.
It's hard to breathe though. It's hard to breathe, but that's just what I do.
That's
So
smart.
how do you figure out the patient has the thing? Like it says on the chart?
The chart.
Okay.
The chart will tell you. That's why it's important to remember our 10 steps. One of our steps was reviewing everything we need to review before we do the exam. That doesn't include looking at the patient chart, looking at previous images. Okay? So you will know that. Or if you're upstairs, ask the nurse. Because it should be on the door before you go in the patient's room. It should say contact precautions, airborne precautions, droplet precautions. It should say that on the room, on the door. Okay, but if not, because depending, what if that person just found out they had TB, you know, and then they haven't put it on the door yet? That's why you always got to verify that order. That was one of the answers on the test. You always have to verify that order before you go in because the nurses know up-to-date information on the patient. You know, but the chart isn't up-to-date to that minute, right?
Yeah.
The patient, the nurse is going to know that. Because it's been a time where had a TB exposure where a patient had TB. We didn't know until, you know, after everybody treated the patient. Everybody that treated the patient had to go and get a TB skin test and the chest x-ray to make sure we didn't have TB. So I've had to do that twice, and I don't have TB, so it's a beautiful thing. But you know, it's really, you know, by chance, because just like that, I could have been infected with TB. So let's talk about some bloodborne pathogens, guys. A bloodborne pathogen is a disease-causing microorganism contained within the human blood. Okay. Some bloodborne pathogens include HIV, the hepatitis B virus, and the hepatitis C virus are the most common bloodborne pathogens that put healthcare workers at risk. Okay. We do a lot of ultrasounds for hepatitis. Remember I drew on here how the liver looks for somebody with hepatitis, how it's lumpy and how it's not smooth. It has that rough kind of contour, rough kind of texture. Okay. Typical exposures is via percutaneous injury or direct contact with the mucous membranes of intact skin. Meaning that's like a needle stick, guy. That's why, you know, it's so important that if you happen to be around needles, like if you're doing a biopsy, you know, you're real aware of what's going on. Because when you're doing a biopsy, everybody's so close. The doctor's right here, you know, this is my machine right here, I'm standing on this side of it, the doctor's right here, the patient right here, he's doing a biopsy right here in the rectum, for instance. He pulling out the sample, boom, you know, that blood could be flying everywhere. He pulls it out, hands it to the surgical tech to take the sample off, you know. But at the same time, like, you know, depending on, I've seen them be pretty reckless. You know, I've seen somebody get stuck when they're trying to put in the, what's the number? The, not anesthesia. It's numbing, like local, what's the local? Lidocaine. Guys, I'm trash. Yeah, the lidocaine. I've seen somebody when, you know how the nurse holds it up? Skirt right in her arm. I was like, oh my God. It wasn't funny at the time, but you know, that's what happened when you're in a rush trying to move fast. So, you know, a needle stick is a way you can, you know, acquire these blood-borne pathogens. Okay? So, let's talk about, sorry to put you guys on that. Let's talk about viral hepatitis. Okay? Viral hepatitis is an inflammation of the cells in the liver. Okay? Many forms of hepatitis, guys, from hepatitis A all the way up to hepatitis E, right? Hepatitis affects different groups more than others. Like hepatitis B is real common because a lot of times that's passed on, like, you know, with tattoos or, you know, that's why when you go get a tattoo, that's why they bust open a package now. It wasn't always like that. They used to be able to reuse those needles. But a lot of people, especially like I think, what's the generation after boomers? Like my mom's age, I think that's the like the 55, the generation after baby boomers. You know, let me see. They're really susceptible to getting hepatitis B because a lot of them were, you know, getting tattoos and sharing needles, and it was a time of like when drugs were really prevalent, like heroin and those drugs that use intravenous, you know, with, you know, intravenous ways to get into the body. Okay. So hepatitis A, B, C, D, huh? Which one? It could be. It could be. It could be. Yeah, I don't know why. I feel like it's cloudy today. It's cloudy. Hepatitis A, B, C, D, E are transmitted via the fecal-oral route, while all other hepatitis viruses are transmitted via blood or bodily fluids, such as healthcare workers' accidental needle stick exposure. Okay. The most common blood-borne infection in the United States is hepatitis C. It is important to note that hepatitis, specifically HBV, hepatitis B, can live within pooled, dry blood for more than a week. Okay. Hepatitis can also lead to permanent liver damage, can cause cirrhosis. Guys, you know that the liver, you guys learned this, that the liver can regenerate its cells, right? So it can make itself better if you haven't abused it tremendously. Okay? So permanent liver damage, cirrhosis, which is what I kind of drew on the board, lumpy kind of irregular shaped liver, portal hypertension, or liver cancer if you have it long enough. Okay? Vaccines are available for hepatitis. No, I know usually like with hepatitis at first, before your liver get big at first, you'll notice it's on ultrasound. Somebody who have hepatitis not for a long time, because hepatitis, these people that have hepatitis can have hepatitis like 30 years, 40 years, and they won't even know. But now there's vaccines for it. There's also a cure for hepatitis now. My mom even had the cure. I forgot what it's called now, but it's like a 6-week kind of program that you're doing, and you're taking medicine every week for 6 weeks, and you know eventually you can be cured of hepatitis.
But I believe hepatitis C is uncured, right?
That one is.
Yeah.
That one is. She had Hep B. It's like a lot of hepatitis. I think it's A. It's common in the Asian community because of diet. You know, so we'll get a lot of exams for hepatitis A. You know, on Asian people. You'll start noticing a lot of different exams for different demographics. You know, a lot of like a pelvis exam for what's the vaccine that women were getting, that the kids were getting a few years ago? HPV. That's really common amongst the Hispanic community. Just like fibroids are common amongst, you know, black women. You know, enlarged prostate is more common among black men. You know, so you'll start noticing that a lot of exams, you'll notice that the same similar people or same ethnicities come in for those exams. You'll notice that once you start working. Okay. So again, like I said, these people may have hepatomegaly, meaning the liver may get big at first. They may experience jaundice or yellowing of the skin because maybe the bowel circulation isn't functioning the way it should. So then it's leaking into the body, causing you to turn yellow. Or you'll notice when somebody's eyes, you ever seen somebody with yellow eyes having jaundice? Okay? So that's definitely could be a liver function. But after a while, the liver end up getting smaller. After if you have hepatitis for a long time, and you ever see somebody with, with a site like real big ascites, big old belly, you can see the veins in their stomach. You know, they probably have a cirrhotic liver that's maybe this big now, and they have a whole abdomen full of fluid. Okay, so like I said, it gets big at first, then it gets smaller. Alrighty. Most healthcare employers require workers to receive these vaccines prior to employment. Everybody had their hepatitis vaccination, right? It's like a 3-stage kind of vaccination. HIV and AIDS, guys. There are 5. HIV and AIDS are not often discussed while we're in the 80s and 90s. They're still a critical health condition that sonographers must understand. Okay? HIV is a virus that can lead to AIDS. It is a retrovirus, which means that it has a propensity to alter your RNA and DNA. Okay? You know, think about HIV and AIDS. You know, they make you real susceptible, immunocompromised to getting infections. You know, which is a big deal for that. It is a 5 phases of symptoms. Phase 1 usually starts off, like flu-like symptoms. You know, they may not think of it as a big deal, and it may show up no signs of infection through the virus site to be transmitted. By the time they reach stage